Ministry words, lead-ins, and comfort. This must be such a difficult time for you. Please accept my deepest and sincerest sympathies. My heart goes out to you. I wish I could do more for you at this difficult time. Kind of feeling, sort of feeling. As I get it, you felt that. I'm picking up that you, sort of a feeling that, if I'm hearing you correctly, to me, it's almost like you were saying, I sort of hear you saying that maybe you kind of made you feel, kind of makes you feel. The thing you feel most right now is sort of like, so you feel, what I hear you saying is, so as you see it, as I get it, you're saying, what I guess I'm hearing is, I'm not sure I'm with you, but I somehow sense that maybe you feel, I really hear you saying that. I wonder if you're expressing a concern that, it sounds as if you're indicating you. I wonder if you're saying, you place a high value on, it seems to you, like right now, you often feel, you feel perhaps, you appear to be feeling, it appears to you, as I hear it, you, so from where you sit, your feeling is now that I read you as, sometimes you must have felt. I sense that you're feeling, very much feeling. Your message seems to be you appear, listening to you it seems as if, I gather, so your world is a place where you communicate a sense of, you convey a sense of. It sounds as if, I'm wondering if you're saying, perhaps, maybe, is it possible that, would this fit? Do you suppose? Here's something I'd like you to think about for a minute. I'm interested in hearing your response. I wonder if, could he be, is it possible? Does this make sense to you? How do you react to this perception? What is the loss in your life that you've never grieved over? What was a major loss you can remember experiencing during your teenage years? Describe what it was and how old you were. What is the worst loss you have ever experienced? What is the most significant material loss you've ever experienced? What is the most recent material loss you've experienced? What was an occasion when you lost hope? If you lost love in a relationship, what was the most difficult part of coping with it? What is the most significant relationship loss you've ever experienced? What is the most recent relationship loss you've experienced? Has the way in which you view yourself changed recently? Could it be that a dream you had or some plans you made have gone by the wayside? What physical changes have occurred in your life in the past 5 years that may have been significant losses to you? In what way have any of your roles in life changed? How did this change your life and the way you view yourself? Has any significant person left your life or group recently? Is there any kind of loss that you've experienced that doesn't make sense or you can't seem to get any closure over? Did you end up with the feeling that it isn't real or that maybe a bad dream, maybe it's a bad dream and you'll wake up? Could it be there are some if-only questions running through your mind? Often when something like this occurs, we look for someone or something to blame. Has this occurred yet? Do you need any assistance with the medical or legal community? I'm wondering if you've experienced any feelings of helplessness or the desire for someone to come in and take charge. Often when something like this happens, there are regrets or a feeling that something is left unfinished. Has this happened to you? What are the why questions that you've experienced so far? Do you ever wonder if you'll recover from this loss? Will you survive? Do you wonder if it's all right to continue with your life, without whatever or whomever has been lost to you? Do you wonder if you can be happy and fulfilled knowing that what you've lost is really gone and that your life will now be different? If I were in your situation, I would be quite angry. Could it be that there is some anger because the person who died has left them behind to face a lot of legal work and loneliness? Anger at yourself for not doing enough? Because of the change in lifestyle inflicted upon them? Over role changes that have to be made within their family? For what is perceived to be a loss of control in their life? That family and friends have gone back to their normal lives and aren't thinking about their grief. That the rest of the world busies itself around them as though nothing has happened, being angry with God. What is the pain behind your anger? What can you do with the anger? How can it be managed as well as dissipated? Who or what have you said goodbye to in your life? Is there something or someone you need to say goodbye to in your life? Could it be that you just can't think clearly, like your mind isn't working? Could it be that you feel stuck, like nothing you do seems to help? Perhaps you feel immobilized and you're thinking, why try? Nothing I do seems to help. The worst is over for now. My name is Tiffany and I'm here to help you. Let's come and sit over here where I can hear you better and you can be more comfortable. We can begin the process of discovering what we can do together. How is that different from before this happened? What issues in your life need to be attended to immediately? What issues can be postponed until later? What has happened to make you so upset? Can you tell me the reason you're so upset? I would like to hear what you have to say. I'd like to hear what happened. What you have just said sounds important to you, and in the future we can talk about it. However, right now, it doesn't seem directly related to your real concern. Let's come back to that. What else might be done at this time? You know, I am concerned about what's happening to you at this time. Let's do this for now. It's common to feel this way, but in reality, it's doubtful you're going crazy. Your reaction and feelings are normal, considering all that you have experienced. With all you've been through, I'd be a bit concerned if you weren't reacting in some way. Let's consider this possibility. What if you were to? What might happen if you would? What do you think someone else might try at this time? Let's think of a person you feel is a real problem solver. What might that person do? You know, you've brought up so many good points that I want to stop and clarify some of them. Let's stop for a minute. Alright, hold it. None of you is listening and you're getting nowhere. Now this is what we are going to do if we are going to get anywhere. You're feeling kind of hopeless about it and doubting if it's worth trying. I guess if I were in your situation, I would be hurting and feeling the loss like an empty spot in my life. I wonder what you might be feeling at this time. There will be a time when you feel the hurt and loss and you'll probably weep. Maybe this isn't yet the time to weep, but it will come. What can we try at this time to change this situation? I would like a couple suggestions from each of you, and I would like to know why you feel your suggestions would work. I saw you come into my office by yourself, and you have been a big help by being active, able to provide so much information about your difficulty. You're concerned that you are not communicating well, but you are very clear and doing very well in telling me the problem. Tell me your story. Symptoms, a sign of coping and as productive and healing mechanisms and as a normal part of the recovery process. Given what you have been through, if you didn't have the stressful reactions, depression, the short fuse of times, dwelling on what happened and whatever, then I would really be concerned. Although this may be difficult for you to believe right now, you may find that there will be some positive benefits as a result of the experiences you have had and your willingness to face them and work through them. What would give you a greater feeling of safety at this time of your life? What gave you a feeling of safety before this trauma occurred? What triggers can you handle now? What triggers do you feel you might be able to handle after a few more months of healing? What triggers do you feel you might be able to confront in a few years, maybe? What triggers do you plan to avoid for the rest of your life? You've survived until now. How could this be worse? You told your story. How will you be different next month? How will you be different next year? Remember, you can write the last chapter of your trauma. It hasn't been written yet. Don't define yourself permanently as a traumatized person. How will you know that you are better? Let's say you made a videotape of when you're better and you bring it in and show it to me. What would you point out to me in the video to indicate that you were better? Can you tell me what happened? Can you tell me what you've been through? I'd like you to describe for me what you experienced. I'd like you to describe what your first thoughts were in response to what happened. What were your thoughts when you saw what was happening? What was going on through your head? What was the first thought you had when you went off autopilot? What was the first part of the experience for you personally? When this happened, how did you feel? What was it like for you? What did you feel at the time? What are you feeling now? What physical or psychological reactions have you noticed? Have you experienced any signs of distress since this happened? What are some of the stress responses you've experienced? Could it be that you've experienced, can you tell me what you've been through? Can you tell me everything you feel I need to know in order for you to know that I understand? If your emotional pain could speak, what would it say? Could you take a few moments and describe the situation you are in now? Could you give me a description of what has been happening to you in recent weeks? What is preventing you from doing in your life now? What is the memory of preventing you from doing in your life now? Although what you have experienced is a terrible thing, can you think of anything positive, even a small thing that has come out of this experience for you? Was the stressful experience as bad as it could have been, or could it have been worse? Can you recall a time when you were nearly overtaken but instead you managed to cope? Can we use any of the information to change the way you are handling the situation? What would help you recognize little signs of recovery? What do you need to remember or tell yourself in order to feel okay and in order to cope better? What advice would you have for someone else who is in this situation, has experienced a similar problem, or is having difficulty with the memory of this? What goals do you think you should be working on in treatment or training? How will you know when your goals have been achieved? Do you know of any other people who have had similar experience? Do you know of any other people who are in a similar situation? Who? How did they handle it? Before the trauma, what was your biggest struggle then? What fulfilled you? What did you enjoy the most? What did you look like then? Please be very specific. A video or picture might help in this process. Who were your friends? What did you look like and not like? What did you like and not like about yourself? Who did you get along with? Who didn't you get along with? What did you believe about God then? What were your Christian practices, such as prayer? What were your beliefs about life then? What were you realistic about? What were you naive about? What did you want to do? What did you want out of life then? What were your goals or dreams for yourself then? What are your goals or dreams for yourself now? What would you like to be different now? What would keep you from growing and changing? Could it be that you thought or felt, I haven't seen you cry for a week. If I were in your situation, I would probably feel like crying. I don't want you to worry about crying in front of me. It's hard to feel this sad and not express it in tears. You may find me crying with you at times. I hope you feel the freedom to express your sorrow and tears in front of me. I won't be embarrassed or upset. I just want to be here with you. If I don't see you cry, I would be more concerned. Your crying tells me you are handling this in a healthy way. If I had experienced what you have been through, I would feel like opening my eyes and letting the flood of tears come pouring out. Do you ever feel like that? It is natural to feel anger and hostility toward everyone and everything that had to do with your loved one's death. I feel angry too. You must be very angry that your has suffered and that you can do nothing about it. It is normal and reasonable to be very angry and resentful when you have lost your and others have live and healthy. You have lost your and you have a right to be angry and frustrated. It must be hard to find the words to express your anger, helplessness, and frustration. It is important that you allow yourself to express your anger and rage no matter how much others try to discourage you. Tell me about your friend. Whom do you have to help you make decisions at this time? What are some of the decisions you are thinking of making at this time? You did the right thing by calling. I'm glad you called. I think there is help for you. What has happened in your life to bring you to this point? What's been going on in your life in the past 3 months? What would need to be different for you to go on with your life? What would you need to help you? What is it you would like to help with at this time? What would you like me to know about you? What would you like me to understand about you? You seem to be depressed much of the time. How much have you been depressed over the past few weeks? When do you get depressed? Have you ever thought that life just isn't worth living? Have you thought of ending it all? This must be such a difficult time for you. Please accept my deepest, sincerest sympathies. My heart goes out to you. I wish I could do more for you at this difficult time. That's a question a lot of children ask. Lots of children want to know about that. You made a mess at the table before. Did your father leave then? Did your older sister ever make a mess? Perhaps you are afraid you'll never see your daddy again. Lots of children feel that way. It's okay to be sad. This is how we feel when someone dies. This is a very, very sad time. A very, very sad thing has happened. Mommy and Daddy are sad because people at church are sad because taken from the Complete Guide to Crisis and Trauma Counseling by Dr. H. Norman Wright. For personal use or nonprofit use only. Thank you.